In this short video, we'll be going over some of the basics of how to explain life length's TAT test to your patients. We'll examine the report in some detail and also cover how best to respond to frequently asked questions. Either you or your patient has received the report electronically. You can elect to go over the report on your monitor or print it out and review the hard copy together. There are two categories of results. Measurements. These include the individual lengths of more than 100,000 leukocyte telomeres. From this analysis, we determine the number of critically short telomeres, and then there's comparisons. Your patient's results are compared against the results on the general population in LifeLength's database. This allows normative data, and along with information the patient provided in their questionnaire, provides for the calculation of biological versus chronological age. The easiest way to go through the report with patients is to go page by page. Please note that LifeLength has obtained and reported only anonymous data, and we do not have patients' names. On page 2, you'll find a picture of your patient's telomeres. The telomeres show up as pink dots against the blue nuclei. This is accomplished through the use of fluorescent probes, a specialized microscope, and proprietary software, a process that is unique to LifeLength and the TAT test. On page 3, we've provided some basic definitions for the patient. Depending upon educational level, it may be helpful to highlight a few of the terms, specifically that we've measured their white blood cells, called leukocytes, and that these are a good reflection of total body aging. Telomere length is measured in kilobases or kbs. You can point out the difference between median and average, or mean, and how the most important measurement of telomere length is the median telomere length, or MTL. You can note that for statistical reasons, we look closely at the bottom 20th percentile to determine how many of the telomeres are short. Page 4 covers some basic measurements and comparisons. We begin by showing median telomere length. Next, your patient's MTL is compared to the results in LifeLength's database. The black dot shows their result with the age band and percentiles. It is best to be in the upper band levels. At the bottom of the page, we show the comparison of the patient's biological versus chronological age. Biological age is estimated based on weighting between the telomeres result measurements and adjusted for chronological age. On page 5, we show the percentage of critically short telomeres representing the lowest 20th percentile. The ranges on the graphs on pages 4 and 5 are dynamic and are based on the patient's age. So if two patients take the TAT, and one is 20 and the other one is 40, they will have different ranges on their reports. One of the main values of LifeLength's telomere testing is that it provides an accurate, reproducible, and sensitive picture of telomere length. If your patient has had several tests, these will be shown on this page, allowing for a visual representation of the rate of telomere attrition. On pages 7 through 9, we've included scientific references. If the patient authorized that their questionnaire be shared with you, you'll find alerts highlighted in light blue and references to studies that specifically relate to risk factors or conditions that your patient described. Alternatively, these pages may just be of interest to scientifically minded patients. Finally, on the remaining pages is general information about telomeres, including responses to the most frequent questions you may be asked. Your discussion with patients will most likely fall into two categories. The first are those patients whose results are within normal range and for whom biological and chronological ages are nearly identical or more ideal for the patient. You can assure these patients that the results are highly accurate, and you now have a test for subsequent comparisons. Highlight the importance of getting LifeLength's TAT test next year to determine the rate of telomere attrition, which is really their rate of cellular aging. This is a great time to reinforce the importance of lifestyle and its impact on well-being. The second category is those patients who have a high preponderance of short telomeres. To provide a measure of reassurance, you can point out that our cells do age heterogeneously, and telomere length can be affected in the short term by acute illness. Now, if this is the case, test results can be repeated in several months or when the acute episode has resolved. A preponderance of critically short telomeres can serve as a wake-up call for patients to reinforce adherence to lifestyle, supplementation, and medical programs. Annual measurements will reflect the rate of telomere attrition. Those patients who undertake and sustain meaningful improvement in lifestyle should normally expect to see a decreased rate or even stabilization in their telomere attrition. Be aware that the finding of extremely short telomeres may be representative of more serious conditions. Depending upon the patient's risk factors, history, and medical condition, this may call for additional diagnostic tests. For the first time, you and your patients now hold in your hands a precise, reproducible, and scientifically valid assessment to either begin or reinforce the journey to health and well-being that you've both embarked on.